A very good morning to one and all. Many of you, straight away we'll go to the talk. Many of you sitting here, the words displayed on the screen may be Greek and Latin, but my job here is to make you understand and clear your doubts and go back with a fresh mind. So to start with, if a given picture, if I ask somebody to explain the physics of these two individuals, one may say the person on the left is well-built, muscular fellow, and the one on the right is an obese or a fat fellow. So is it all about the description of the physique? To know more about it, we have to understand what is anthropometry and body mass index. Anthropometry is a Greek word which basically means measurement of a human body. Why does this play an important role here? Because different sports need different body build-up. A person who's doing weightlifting cannot come and do gymnastics. The same way a person who's doing gymnastics can't do weightlifting. So body build-up is important. So what are the basic body types? Mainly, there are three types, which are ectomorph, mesomorph, and endomorph, which are depicted in the picture. And ectomorph is the one who's tall, thin, who has less of muscle mass. And endomorph is the one who's having a lot of... Endomorph is the one who's on a bit heavier side, mostly of the body composition of fat, and mesomorph is the one who's well-built, well-muscular fellow. Next, going on to the body mass index, it's a simple calculation which everyone can do. You need not go to a specialist to do this. It's calculated by having weight divided by height and height squared. So where do we stand and why is it important? To know whether we are on the overweight, obese, or underweight side, where the healthy is between 18.5 to 24.9. Why does this play an important role in badminton? There was a study from Brazil which says that for a badminton player, approximately 22 is an adequate BMI, and his body composition should be a mixture of both ecto and mesomorphism. Whereas a study from India, based on the BMI, says that our players are undernourished and their BMI is about 17 or 18. This plays an important role because winning a championship match is not still a chance. It involves physical and mental attitude. Just putting forward a question. To play badminton, which group of muscle is to be strengthened? And I want to take a vote among the given choices: hand, leg, abdomen and back, and all of the above. Can I have the audience put up their hands for those who think that the first option is the correct one? To play badminton, which group of muscle is to be strengthened?
To play badminton, which group of muscle is to be strengthened? Is it hand, leg, abdomen and back, or all of the above? Who can give the right answer for this? Please put your hand. Okay. Your good name?
Mohan. All of the above.
All of the above. Can I take some more choices?
Yeah.
Okay, one more. Yes, sir.
All of the above, men.
All of the above.
That makes my job easier. The next, we're going to see what is kinetic chain. A body is interlinked from head to toe like a chain. It's a concept which is borrowed from engineering and which says that our body is a combination of several successfully arranged joints constituting a complex motor unit. It says that almost 54% of our energy is derived from the leg, hip and trunk. And this force, while you play badminton, the upper limb is not the only one which is important. The energy is derived from the lower limb, abdomen, and it goes up to the shoulder. The scapular or the shoulder blade regulates and funnels the energy and goes into the upper limb, which is the arm, elbow, and wrist, and it's delivered there. And only 13% of the energy is derived from the shoulder blade. So once it is linked from head to toe, there must be one area which is strong enough, which is the core, which is the abdomen and back muscles. So these are a complex series of muscles from abs, except for the upper limb, arms and legs. The others are included in the core. What are the benefits of strengthening these core? So we'll be able to increase our running performance and to prevent injuries. So how do we do that? We do that by exercises. Exercises are basically two types, aerobic and anaerobic. From the picture, you can say that aerobic involves mainly running and to lose weight, whereas anaerobic involves building up of muscle mass. So can we train a player similar way for all the games? Absolutely not. A player on the left, an athlete on the left who's a marathon runner cannot be trained in the same way like a sprinter. Likewise, badminton, which involves short and long rallies, cannot be trained only with aerobic and anaerobic exercises. So it has to be equal in proportion. About 60% of our exercises for badminton preparation should be of aerobic exercises, where we burn fat and lose weight, whereas we only 40% should be constituted of anaerobic exercises. Once we start playing, we are prone to injuries. Injuries are basically two types, acute or overuse injuries. To explain this aspect, I like to compare a car tire with our player. So acute injuries. A car tire can be damaged in two ways. One is a run flat tire following a puncture. The same way an athlete can get injured during a play. Otherwise, an ill-maintained tire with an imbalance and a worn-out tire can cause overuse damage to the car. The same way, an athlete, if they are not trained properly, can undergo overuse injuries in any aspect of the muscle or joint. So there are three most common sites of pain or injury: the shoulder, knee, and ankle, among which knee and ankle are prone for acute injuries. So we have a player who is playing and she had a fall. She's taken her to a doctor and he says that you have undergone a sprain. What is sprain? Sprain is nothing but a tear or injury to a ligament. So this is an ankle joint where the medial inner and outer pillars are there in the form of ligaments. These ligaments can get injured, which can break the kinetic chain and decrease your performance. The same way, jump alignment, you will be hearing of it a lot today. What is it? A player can jump and land in any way. As you see in this picture, people jump in different ways. Likewise, during a match also, we will not concentrate on how we jump, but they can land however they want. Whether it is good or not is in our hands as a sports medicine specialist to say how you are landing. The knee can go either inward or outward depending on your jump. So based on that, we say the terms varus and valgus. So this is a normal knee, and when the knee goes outwards, then it is called varus, and when the knee kisses against each other, we call it as either a kissing knee or a valgus knee. This is important because valgus jump landing causes more of knee injuries, especially anterior cruciate ligament injuries. So based on this, we had conducted from Ortho 1 a study among school-level basketball players, and around 60% of those players were landing in valgus. The video on the left shows a neutral landing, whereas the video on the right shows valgus or a kissing knee. Next common terminology what we use is shoulder blade. This is, we call it as scapula. It's present in our body. Why is this important? Because that is the only, shoulder blade is the thing which regulates the energy transferred from the lower limb, abdomen and everything, and transmits to the upper limb or the arm. So normally this shoulder blade goes up and down smoothly when we lift our arm up and down. When this mechanism is disrupted, we have the term called scapular dyskinesis, which is altered movement. So why is this important? Because scapular dyskinesis is an at risk for shoulder injuries. About 42% of overhead athletes are prone to have scapular dyskinesis. This can be easily picked up by a coach or anybody when they see their players having their arm up and their players arm up and down. So here is. So where the cursor is, that is where the scapula is abnormally protruding, that is called scapular dyskinesis. Finally, the position of your arm and foot while playing. The arm, when you have it like this, when you shake your hands, it is neutral in position. That can go either the palm facing upwards or the palm facing downwards. When the palm is facing upwards, we call it as supination, and when the palm is facing downwards, we call it as pronation. Same way, in the foot also, we have the similar terminology. Foot is important because that is the lowermost area of our body. So this straight line indicates that this limb is neutral, whereas here the foot is turned outwards. Hence, we call it as a pronated foot. Why is this important? Because a pronated foot can break the kinetic chain and can cause overuse injuries in the joints or muscles above it. Hopefully, I have done my job of introducing you to these terminologies so that you can catch up with all the other speakers as the day passes. Thank you.